Hello, good people. This is Dr. Stephen Okoro, your physician and health coach. Still continuing on the discussion of peptic ulcer disease. Today, we are going to look at how to confirm that you have peptic ulcer disease. We've talked about the symptoms and the complications. So you can check our previous videos on those topics, so you'll be able to understand this one. So, assuming you have the symptoms, or you suspect that you have peptic ulcer disease, you need to be sure. How will you ensure that it is? Because it could be something else. The first thing you have to do is to go to your doctor. So when you go to your doctor, when you get to the doctor will review you. He will have to take a history of your symptoms to know, about the abdominal pain, the nature of the abdominal pain, its relation to food and other things that could be responsible. And then whether you take a lot of painkillers, the non-steroidal anti-inflammatory drugs as we mentioned, and then he may look out for the possible presence of complications as we discussed, such as bleeding, gastric outlet obstruction. The doctor will be able to check for such things to ascertain whether they are present. And then he will conduct a physical examination on you, to look for necessary findings that will help him to arrive at a proper diagnosis. Now, when he has finished with that, he will now send you for tests, investigations. Now, among several investigations, the most relevant that will help to confirm the presence of peptic ulcer, number one is H. pylori testing. It's a simple test that will require you to submit blood or stool. There are some tests that can be done through the breath. So, the importance of this test is to identify the presence of H. pylori bacteria. Remember, we said that the commonest cause of peptic ulcer is H. pylori. So, if H. pylori bacteria is present, the test will be H. pylori positive. And that means you will require to be treated for H. pylori. And now, the fact that you have H. pylori does not automatically mean that you have peptic ulcer. There still needs to be another test to be done to confirm if you indeed have peptic ulcer. That test is called the upper GI series or barium meal studies. It's a special type of X-ray whereby you will be required to drink a solution containing barium. That solution appears opaque in the X-ray. So when you drink the solution, the X-ray of your tummy will be taken. The solution containing the barium will now show an outline of your stomach, which is what we see, in the X-ray film here. It shows a proper outline of your stomach. Now, one thing about that barium is that if there is an ulcer, any area that contains ulcer, it doesn't fill up that area. That area will appear dark, as you see in this film. You can see an area, this circular area. It shows the presence of the ulcer. And then the barium meal X-ray will equally show if there is something looking like an obstruction or narrowing of the entrance to the duodenum, the intestine. In other words, if there is evidence of gastric outlet obstruction, which means that the exit from the stomach may not be big enough, and then you see that the stomach will be looking abnormal in shape because of what it is containing. So that is the importance of these barium meal studies. It will help to identify the ulcer. But now there is a more sophisticated way of identifying or confirming if you have peptic ulcer. That test is called the upper GI endoscopy. It is a special equipment that will be handled by a specialist called the gastroenterologist. This equipment has a flexible tube that has a tiny camera at one end, a light source, and instruments for collecting biopsy. So the person is put to, made to sleep a little, and then it is passed through the nose or through the nostrils and guided into the stomach. And as he's doing it, the instrument will enable him to see, real time with his eyes, the view, a proper view of the lining of your stomach. Just as we see in this picture, this is what the gastroenterologist is seeing in this person. Here you see the lining of the stomach, and then this is an ulcer showing. You can see that there is a bridge here. This is the line of the stomach. This is the outlet from the stomach leading into the duodenum or the intestine. There's an ulcer here. So the beauty of this endoscopy also lies in the fact that if you are having bleeding, if that ulcer is bleeding, he will see it. If there's evidence of cancer, or if there's a growth, occurring apart from that ulcer, he will equally see it. And then the endoscopy will enable him to take a biopsy that will be sent to the lab. That tissue, a piece of tissue will be collected and sent to the lab, where the tissue of the stomach will be studied to know whether it is normal, whether it is cancerous. Even H. pylori bacteria will equally be checked or cultured from it. And then it is a very beautiful way, definitive way of identifying peptic ulcer. And sometimes it enables them to even do the treatment. The endoscopy can equally enable them to do a treatment if it's something that requires that treatment, of closing the ulcer eventually and all that. That is the importance of the endoscopy, the upper GI endoscopy. So, but the only thing about the endoscopy is that it is a bit expensive. The service is a bit expensive, but it is worth it. That is the way to know whether you have peptic ulcer and how it is and how it can be handled. So in summary, if you suspect you have peptic ulcer, you have to go to see your doctor for a review, and then he will send you for H. pylori testing. You may need to do barium meal studies, and if possible, do an upper GI endoscopy. So in the next video, we are going to talk about the treatment. After the diagnosis has been made, how will the ulcer be treated? So if you have received adequate information or value from these videos, please do not forget to subscribe, like, or share, so that you will be getting more of these videos, and more people will get to get the information that will enable them to be on top of the situation concerning peptic ulcer disease. Thank you very much for your time.